You're an active person. You may work, travel, exercise, but while you're doing all of these things, you may not realize that you could have a silent killer inside your body, an aortic aneurysm. Aortic aneurysms can occur in two main places: the abdomen, called an abdominal aortic aneurysm, or the chest, called a thoracic aortic aneurysm.
An aneurysm is a ballooning of the blood vessel. It's very much like a conventional balloon. The bigger it gets, the risk of rupture gets greater. When an aneurysm ruptures, if a patient completely ruptures the aneurysm, they bleed to death. If it's contained and you have time, then it's still a very high morbidity mortality operation.
Ruptured aortic aneurysms kill more than 21,000 people per year in the U.S. alone, making this disease a leading cause of death among seniors. Unfortunately, many people who suffer from this condition don't realize it until it's too late.
In most cases, aneurysms of the aorta do not cause symptoms until they enlarge and compress an adjacent organ, or in the worst case scenario, they would break and then the patient bleeds to death. So that the real issue is, how do you pick up and diagnose an asymptomatic problem that's essentially lethal?
I lost my father to an abdominal aneurysm in June of 2000. He was 65, a smoker, and had a family history of heart disease. And his aneurysm went undetected even though he was having routine physicals with his doctor.
People who are over 50 years of age and have one or more of the following conditions may be at risk of having an aortic aneurysm: high blood pressure, current or former smoker, atherosclerosis or family history of aneurysms. Regular screenings for people who are at risk can be critical to identifying and treating the condition early.
I had massive chest and abdominal pains, and went to the emergency room, and while I was there they did a CT scan and discovered the aneurysm in my aorta.
Screening for aneurysms at the present consists of ultrasound, which most people are familiar with. You rub the ultrasound probe around and can see the anatomy. The other frequent way that aneurysms are picked up or diagnosed is with CT scans or MRI scans, either for symptoms of the aneurysms itself or looking for something else.
7 years ago, I coughed up an enormous amount of blood, and at that time, frightened, I went to the doctors and they took an x-ray. They noticed that there was an amount of fluid on my lungs, and so they ran a second test, the CAT scan, and noticed that I had a thoracic aneurysm on my aorta. At that time, they sent me over to UCLA Harbor Medical Center for emergency surgery.
If diagnosed with an aortic aneurysm, treatment could begin with medical management, which usually includes keeping your blood pressure under control, quitting smoking, reducing dietary cholesterol, and monitoring the aneurysm for growth. If surgical intervention is necessary, there are a variety of options, including minimally invasive therapies.
Therapy for aneurysms at the present time is either conventional surgery, where you open the body cavity and replace that with a synthetic tube, or the newer therapies are endografts, which in both of these locations, abdominal and thoracic, have replaced now many of the conventional operations.
Endovascular aortic repair is a minimally invasive therapy that uses a special device called an endovascular stent graft, which is placed inside the damaged area of the aorta to separate the aneurysm from the normal blood flow.
Stent grafts are a combination of a fabric, Dacron, something that people are familiar with, and a metal stent. They're placed with catheters through the blood vessels, usually through the femoral artery, up through the aorta, and then open up to reline that disease segment without having to do the open operation.
Endovascular stent grafts for repair of aortic aneurysms is not new technology, but it is technology that is constantly evolving to deliver even better outcomes.
Stent grafts were originally developed in the early 1990s. Commercial grafts in the United States were approved in 1999, and they've been used throughout the world and for more than 15 years to treat both the abdominal and the thoracic aneurysms. The durability is yet undetermined beyond that, but in many cases, patients have now been successfully treated and are somewhere in a 10-15 year range with successful exclusion.
I came in 2002 here to Harbor and had the procedure, the stent graft, done at that time, and have had no health problems since. It's been amazing. And I'd never been through a procedure that was so simple and so easy and so well explained to me. I was completely comfortable and realize now that I could have done it the other way and have been 6 months in recuperation rather than 3 days.
It's been 4 years since the surgical procedure has been completed, and since then my life has dramatically changed. I've gone to the point where I can work out for longer periods of time. I have more energy. My life has changed where I was able to get pregnant and fully carry my twins without any problems. So life has just been really great. My health is great. I've checked out with the cardiologist wonderfully.
The next generation of endovascular aortic repair technology has recently been introduced by Medtronic for the treatment of abdominal aortic aneurysms. It's called Endurant.
The unique characteristic for the stent grafts is, first off, it eliminates having to have an open operation. And in many cases, although that's a very successful operation, patients are in the hospital for several days and they really don't feel well for several months. With the stent graft therapy, we can insert these through the blood vessels in the groin in most cases, and patients sometimes are ready to go home the next day or in a very short period of time and return to normal activity very quickly.
The Endurant stent graft system offers benefits to both physicians and patients. For physicians, the device is low profile, which offers easier access to tortuous anatomies and also offers excellent formability to the vessel wall. And for patients, they have the confidence in long-term safety and efficacy through a broad range of clinical trials.
With Medtronic's Endurant stent graft, physicians now have a next-generation device that will allow safe treatment of even more complex abdominal aortic aneurysm cases than was previously available to them. To learn more about abdominal aortic aneurysms and the Endurant stent graft, visit medtronicendovascular.com.